Patient safety. It's something we all expect when we're in a healthcare setting, right? It feels like it should just be there. But have you ever really thought about what it takes to build it? Let's get into it. Seriously, think about that for a second. The moment you walk through those doors, you're placing an incredible amount of trust in people and in systems you don't fully see. So, what is it that makes that trust worthwhile? That's really the big question we're going to unpack today. All right, so here's our game plan. First, we'll talk about why this became such a huge deal. Then we'll look at how this protective safety net actually got built. After that, we'll see how it all works day to day. And finally, we'll peek into the future to see where things are headed. So let's start at the beginning. Why did patient safety suddenly become this massive, critical field? Well, it all kicked off because of a pretty jarring wake-up call about medical mistakes. You know, for most of history, medical errors were sort of seen as a sad but inevitable part of practicing medicine. But things started to shift in the late 20th century with this quality movement that really zeroed in on patient outcomes. But the real earthquake hit in 1999. A report called To Err is Human came out, and it dropped an absolute bombshell. It showed that up to 98,000 people were dying every year in the US alone because of medical errors. Suddenly, it was crystal clear these weren't just isolated accidents. This was a systemic problem that had to be fixed. So yeah, that report lit a fire under the entire healthcare industry. It was time to start deliberately building a system of protection, kind of safety net. So let's look at how they started weaving that net together. The response really came from all directions. You had key organizations popping up, like the Agency for Healthcare Research and Quality, or AHRQ, to spearhead the effort. They started setting really clear goals, like cutting down on infections or making sure medications were correct. And this wasn't just happening in one country, it went global. Initiatives like the World Health Organization's High Fives Project worked to get everyone on the same page with safety solutions. But it wasn't just about new health programs. A super important layer was added to this safety net, the law. This made it about more than just best practices. New legal frameworks were put in place to deal with liability, to make sure hospitals were following the rules, and, this is huge, to spell out and protect the rights of patients. And a perfect example of this is a term you've probably heard: informed consent. Now, this is way more than just a form you scribble your name on. It is a fundamental legal right. It means you, the patient, have to be given all the information you need to make a smart decision about your own health. It officially puts you in the driver's seat of your own care. Okay, so we've got the organizations and the laws in place. But how does the safety net actually work on a daily basis? You know, how does it catch mistakes before they happen? Let's dive into the mechanics. It really boils down to this constant cycle of getting better. First, hospitals use what are called patient safety indicators. These are just specific data points they can measure to see how they're doing. Second, they have reporting systems where staff can flag mistakes, and just as importantly, near misses. The goal is transparency, so everyone can learn. And finally, they benchmark their performance. Basically, they compare their own safety numbers to industry standards to see where they need to focus on improving. Now, obviously, a system is only as strong as the people running it. And that's where education comes in, which really stands on 3 pillars. You've got ongoing training programs for all staff. Then there's simulation-based learning, which is super cool. It lets medical teams practice for intense, high-risk situations in a totally safe environment. And last but not least, patient education. And this point is so important. This is a crucial takeaway for all of us. You're not just a passenger on this journey. You're an active crew member. When you, as a patient, are informed, when you ask questions and really understand your treatment, you become one of the most powerful parts of the entire safety system.
This system has already saved countless lives, but here's the thing, it's not finished. The safety net is always getting stronger, always being upgraded with new tech and fresh ideas. So let's look at what's coming next.
Right now, there are 3 really big forces changing the game in patient safety: how deeply we're integrating technology into care, the explosion of telehealth, and the incredible power of data analytics. First up, technology. Just think about it. Electronic health records can automatically flag a potential drug allergy for a doctor. Automated systems can dispense the exact right dose of medication every single time. By building these smart systems, we can design powerful safeguards that dramatically lower the chances of simple human error. Next, telehealth. This is a whole new world. As healthcare moves out of the clinic and into our living rooms through video calls, our idea of safety has to evolve with it, right? How do you make sure a diagnosis is accurate without a physical exam? How do you keep private health information secure over the internet? These are the new frontiers, and they demand new safety rules. And finally, data analytics. Honestly, this is a total game changer. By sifting through enormous amounts of patient data, hospitals can shift from just reacting to problems to actually preventing them. They can spot a pattern that might lead to an error before it ever happens and step in to change course. It's about getting ahead of the problem. And that brings us right back to where we began, but hopefully with a new way of looking at it. This safety net isn't just something that hospitals do. It's a true partnership between systems, providers, and us, the patients. Knowing how it all works is step one. The next question is, for all of us, what's our part in making that net even stronger for everyone?